disorders are treatable, but many people do not seek out help until their symptoms become severe. And unfortunately, we see this all the time, that by the time a person comes, their symptoms are so severe that it requires a more severe response, okay? If you have come to the point in your life where you feel that you need assistance, then you are not alone. There is hope and support for you. If you present to the hospital, seek help and are admitted, then this will be considered a voluntary admission. Voluntary admissions can help to identify symptoms, clarify the diagnosis, and stabilize symptoms. So let me say here, if you're listening to me and you've come to the point when you feel or you think that you may need to admit yourself into the hospital for mental health concerns, then I applaud you and I would encourage you to do that. If you do that, then that's called what we call a voluntary admission. Going into the hospital, voluntary, can do a lot of things. Number one, like I said before, like I read here, it can help you clarify the diagnosis. You can get answers, especially if you also may be dealing with other chronic health conditions. And when we talk about mental illnesses, we're talking about medical disorders, okay, because a mental illness is a medical disorder. When we talk about severe and persistent mental illnesses, we're talking about chronic conditions. For those of you who follow this broadcast, you know when we talk about severe persistent mental illnesses or severe mental illnesses, we are talking about a category of mental illnesses that are so severe that they impact all aspects of an individual's life. We're talking about a category of illnesses that there's a federal definition. When we say SMI, it's actual a federal definition, a federal category of certain illnesses, schizophrenia and bipolar, for example. But in general, I'm not necessarily talking about severe mental illnesses. I'm talking about mental illnesses in general. If you get to the point where you feel that you may need to check yourself in, then do so. Okay, there's nothing wrong with that. Just like if you were having a panic attack, if you were having a heart attack, or you were having some problems with your diabetes and you needed to go to the emergency room or you needed to be admitted, that's fine. There's nothing wrong with that. I think we need to get away from the stigma that by addressing your mental health concerns that means there's a problem. No, it doesn't, or that there's something wrong with you. Yeah, it just means that you need to get help, just like you would if you had diabetes or any other concerns. But I want to talk about what happens when you present for an inpatient or a psychiatric or behavioral health admission, because it varies. Okay, it varies really from state to state. It varies from city to city, town to town. It varies depending on whether the type of hospital, private, public, the type of insurance, the time of the day, believe it or not, or the day of the week. It just varies. So what I want to share is maybe some general things that may or may not happen. But so if you are thinking about going into the hospital, or maybe that you may need to have an admission, then just kind of give you some ideas. What I was going to say before I sidetrack myself is that when you, especially if you have other chronic issues, say like diabetes or I don't know, just other chronic diseases, that in addition to the behavioral health or mental health concerns, then going into the hospital may be the best thing, because you can kind of get the medications adjusted, or kind of run tests and see exactly what's going on. But let's talk about this: getting help for yourself voluntary. As I said before, your experience at the hospital will vary depending on your insurance, the hospital, the time of day, your symptoms, if you are admitted involuntarily, and if you are already on medication. So a lot happens when you present there, okay? But just because you make it to the hospital doesn't mean that you or your loved one will be admitted. For example, if you're already on medications, the hospital staff may call your outpatient treatment team for information, make adjustments, and send you home with a follow-up appointment. So what am I saying here? Let's say I present to the hospital. Usually we're going through the emergency room and say, hey, I think I need to go into the hospital. I'm having some mental health concerns, okay? It depends on the hospital. They may call and say, okay, we're going to have somebody come down from the mental health to kind of evaluate you. That could be a clinical social worker, it could be a psychiatrist, whoever. Someone will come down and evaluate. Okay, they will evaluate, and then they'll get a history from you. They'll talk about what's going on, and depending on, and it can go either way. So, for example, let's just say you present to the hospital there. You're talking to the person that's doing the evaluation, and they find out that you already have an outpatient doctor that you see, and that you do have medications, or maybe you ran out of medication, or that you ran out of medications. You have them, but you ran out, or you have them, but they're not working. But that you have an outpatient provider. In that case, that doctor or that clinician, whoever, let's say the mental health clinician who's doing the evaluation at the hospital, may say, okay, so this person already has someone. They may get permission from you to call your outpatient doctor and say, hey, I have so-and-so in the hospital here. What medications do you have him on, he or she on? And they have a conversation. And they may decide just to go ahead, okay, I talked to your doctor, or this is what we're going to do. We're just going to adjust your medications. We're going to let you stay here for a few hours in the emergency room and see how you feel. Or we're going to adjust your medications, and then we're going to let you go home. So they may not admit you. Okay? So that's number one. Number two, what may happen, you may get to the hospital, and let's say you don't have an outpatient doctor, or you may not be on medications, or you were on medications a long time ago, and you may say, I just want to be admitted. They may talk to you, and they may still choose not to admit. They may say, okay, based on what you're telling me, you're feeling bad, you're a little depressed, you're a little, okay, we're going to give you some medications here at the hospital, and then we're going to, in the emergency room, we're going to let you stay over here, stay for a few hours, maybe, a few hours to see how things go, and then we're going to send you home. Okay, that can happen. 3, this is the problem that where it can get tricky. You present to the emergency room. The mental health clinician comes down and talk to you, and you want to be admitted. Like, no, I want to be admitted. I do not want to go back home. This is where it can get kind of dicey, right? Or especially if your loved one, you bring in your loved one to the hospital, or, well, I'm sorry, I'm not going to deviate because I'm talking about voluntary, so I'm going to stick with voluntary. You're there, and you're saying, I want to be admitted. This is where it can get tricky because the doctor there may choose not to admit you for whatever reason. No matter you might want to be admitted, they may not choose to admit you because they don't see a reason. It used to be a long time ago, in inpatient psych wards, the beds are, no matter where you are in the United States, there are not a whole lot of beds. There are not a whole lot of, that's why I said it depends on the day. Like if you go maybe Tuesday, Wednesday, maybe Friday, probably won't admit you. There are not a whole lot of beds. There's not a whole lot of space. And some hospitals, some mental health clinicians, doctors, depending on where they are very particular about their beds, especially when they know it's getting maybe closer towards the end of the week and they expect a lot more people coming in. If you don't have to be admitted, they're going to try hard not to admit you. Okay. Also keep in mind that what the goal, it used to be a long time ago that you can go into an inpatient facility and stay forever, as long as you want to. Now, even if they admit you, they're not keeping you long because the expectation is with the new medications that we have now in 2023, with the new advances that we have now in 2023 when it comes to mental health, that the expectation is that you shouldn't have to be in the hospital for long periods of time. So that's the expectation. So again, if you get there on voluntary, you may be shocked to find out that the doctor doesn't admit you. That's what I'm saying, where I'm going. So you want to be able to make a case of why you need to be admitted. Some people, the magic bullet that people would always say is that I feel like I'm a danger to myself. I feel like I might hurt myself, right? I feel like I might kill myself now. And some people, I've known some people who said that, who really, that wasn't the case, but they said it because they wanted to be admitted. What I'm telling you is that when you go to the hospital, don't be shocked if you're not admitted. What you want to do is have an honest conversation with the doctor or whoever the clinician is about what's going on, okay? So again, just keep in mind that it's not necessarily like you go to, well, even at the emergency room, you go to the emergency room, you may, think you're going to be admitted, and the emergency room doctor is able to do wonderful things and send you home. It's the same thing with the doctor at, for psych, for mental health. And I hesitate because it's not always a doctor. It can be a clinician, a mental health clinician, okay? They may or may not decide to admit you when they do the evaluation. But if you feel that you need to be admitted, you need to make your case. You need to say, no, I need to be admitted. I need to be admitted. I don't feel safe. I need, this is what I need, okay? So just want to let you know, don't be shocked that you don't think you may not be able to march right in, sign in, check yourself in, and they say, oh, come with me. It may not go that smoothly, okay? Now, a couple of things that you want to pay attention to, that while you are in the hospital waiting to be seen, there are a few things to keep in mind. Number one, you may be seen in the emergency room first, unless previous arrangements were made, or you're in a place like in the District of Columbia, we actually have a psychiatric hospital. It's called CPEC, Comprehensive Psychiatric Emergency Admission Hospital, and that's all they do is deal with psychiatric admissions. But which means if you're going into the emergency room first, you may have to wait. Okay, but don't let that discourage you. You may have to wait to be seen because, in the emergency room they do triages. You may be asked several questions. Well, you're going to be asked questions, but you may be asked several questions over and over again. So like the first person that you see, they find out, hey, what's going on as they triage you. Then they have you wait until, again, a doctor may come in to make sure medically, there's no medical concern that's going on, the run test, drug test, whatever, and then you're waiting for somebody to come down from psych, or the person that comes down from psych, maybe the person that runs the medical test. It just varies. Have some patience. Just know when you go there, it may be a wait depending on the time of day that you go. Now, if you have an outpatient psychiatrist on the outside, right, a clinician on the outside, you and that person may have already had a conversation. And ideally, that would be great. Because if you've already had a conversation with your doctor and both of you agree that, hey, it may be a good idea for you to go into the hospital for a period of time, then that doctor ideally is having you go someplace where he or she has some admission privileges, and you're able to kind of move the process a little faster, okay? Ideally, but that's not always the case. But just know it may be a process, it may be a wait, depending on the time of day that you go. If you're taking medications, know your medications, know the name of your outpatient providers if you can.